Texas health system, the patients are represented by two separate and equal groups: the nurses who advocate for their patients and the physicians who help save their lives. These are their stories.
I'm Casey Galloway, and I'm here to introduce this film about patient safety. Patient safety is something important that you should know about as a nurse. Throughout this film, you're going to see different examples of how nurses and doctors have miscommunicated or did other things to jeopardize patient safety. And what you're about to see is going to be some really bad examples of nursing. But don't be afraid, no one was hurt in the making of this film, except for a few nurses, and that leg just healed right up, so don't worry. Patient safety, it's real.
Hi, I'm Cassie. I'm the CNA. I'm here to take your blood pressure. Can I see your arm? You need to pull it over here. Today's my first day. I'm super excited. That looks a little bit big, but it'll inflate. We'll be fine. And I don't really know how to turn this one on. So I know you've been running. I'll just guesstimate. Take that. I'm gonna get the nurse and we'll be back, okay?
Hey, so what were those vitals on that patient?
The weird old lady in the other room?
Yeah, her.
They were all normal. The blood pressure is like 120/80, and I don't know. I think she looks fine. I'm not even sure why she's still here.
I know. I don't know why she's still here. I'll have to call.
She's kind of annoying.
Yeah.
So I think we should.
I'll have to call the doctor and see what she thinks.
Good idea.
Hi, how are you doing, Miss B? Oh, you don't look too well. I'm gonna go ahead and listen to your lung sounds. You don't sound too well either. I'm gonna go talk to your doctor. Hi, Dr. Sheila.
Hello.
Hi, I'm calling about Mrs. B in room 201. I'm kind of concerned about her. I went in there this morning and she said her leg is hurting and she doesn't look too well.
Well, I went in there too early this morning. I guess you're not there, but what's going on with her now?
Well, her vital signs are normal. She's got a blood pressure of 120/80 and her respirations are 14. But I have 7 other patients, so I haven't really gotten to see her chart. I don't really know what's going on with her.
Since I'd gone in this morning, and based on the information, it looks like the assessments are all done well. Let's go ahead and discharge her. I'm gonna write her orders.
Okay, if that's what you think is right, I'll go ahead and do that.
Okay, thank you.
Okay, bye-bye.
Freeze! Did you know that 63% of sentinel events are caused by poor communication? And Michelle here had just told Dr. Sheila actual information using SBAR. All of what's about to happen could easily been avoided.
Hi, Miss B. Were you not very hungry today? Oh, well, Dr. Sheila's gonna go ahead and discharge you. She's gonna send you home on Coumadin and Tylenol, and she said to call her if you have like a cough or like a blinding headache. Okay, so if you just want to get your stuff together, and I'll get someone to take you down. Okay.
You see that girl over here that looks like death? It's because she's dying. Shh, I'm the narrator. You're just hallucinating. Don't worry. Well, she in fact has a pulmonary embolism and is going to die very, very soon.
What?
Shh, I'm narrating. This is an important reason why communication between doctors and nurses is very important. It's also an important reason why storytelling is very important in hospitals.
You ready to go home? Okay, so here's the deal. I had like a really intense Pilates session with my personal trainer last week.
Who was that lady on my bed earlier?
Lady on your bed.
Yeah, she
Someone
was like
had a little
narrator.
too much pain medication.
No.
Anyway, so I can't lift you because my arm's really sore from Pilates. So can you just like scoot out of bed and just pop in the wheelchair? Yeah, okay. The wheelchair's right here. There you go. You don't need to take that with you. Trying to steal hospital merchandise. I see what you're doing.
I still have
Are you good?
no.
Okay. Alright. There we go. These things are a little tricky. No, we're good. We're good.
That same night, Miss B went on to collapse on her front doorstep due to what the autopsy would show to be a pulmonary embolism. Why wasn't she given blood thinners? Why was she discharged if she was weak and unable to eat? Why was she discharged if she was having problems breathing? Why was she sent home on a taxi without her house keys? Deaths due to medical mishap, are preventable or otherwise, are not uncommon, although they are a small percentage of critical incidents and smaller percentage of admissions. But harm due to mistakes is a significant problem. Up to 10% of admissions, some studies have said. Reporting of critical incidents by hospital personnel has become mandatory in 2006. Once an error is reported, it is evaluated and a solution is created in order to prevent similar incidents from happening. Good progress towards reducing errors and fixing systematic weaknesses requires the system to have a good picture of what's going on. Remember, only you can prevent medical errors.
Miss Khan's room 206, Novolog 5 units, sub Q, Q6.
I wonder if they wrote Mrs. Karn's insulin orders yet. Novolog 50 units, sub Q, Q6. Hi, Mrs. Karns. How are you doing today?
I'm doing okay.
You feeling okay? Mm-hmm. Okay. The doctor ordered 50 units of insulin for you. So I'm going to go ahead and administer 50 units.
50?
Mm-hmm.
Are you sure? Because at home the most I take is 15.
The doctor ordered 50. So we're just going to go ahead and give 50. You should be fine.
Okay.
Okay? Where do you usually get it? Do you get it on your arms, on your leg, on your stomach?
My arm.
On your arms? Okay. Okay. All 50. All done. I'll let you go back to resting.
Thank you.
The nurse just gave Miss Carnes here 50 units of insulin when she was only supposed to get 5. She's about to go into a diabetic coma.
Okay?
If the nurse had just simply listened to Miss Carnes or even checked the doctor's orders when 50 sounded like a lot. But instead, Miss Carnes is the one that has to suffer. I'm just gonna recheck Miss Carnes' order. Something seemed really off about that. I just can't get it out of my mind. Oh no! That's a period. Oh my gosh, that's not 50 units, that's 5 units. Oh my gosh, someone's gonna notice. Someone's gonna notice. Oh my gosh, I'm gonna get fired. I'm gonna get sued. I'm gonna get sued and fired. Oh my gosh, I can't afford to go to Cancun this summer. Oh, and I looked so good in a bathing suit. Oh no, should I tell someone? No, I'm not gonna tell anyone. No one's gonna notice. 5 units, 50 units. It's like the same thing. It's the same thing. It's practically the same. You know, this isn't even really my fault. Of course not. Like the doctor. His handwriting's like a 4-year-old. How am I supposed to read that? Why would anyone blame me? It's not my fault. I'm really busy and I have a lot on my plate. You know, I'll just give her some orange juice and she'll just gonna perk right up. Yeah. No one will notice. No one. Hey, they can't prove it with me. Okay, act calm. Just walk away, maybe get some coffee. I'm looking good. See her chart? See this tiny dot right there? That makes the difference between 50 units of insulin and 5 units of insulin. The doctor wrote 5.0 units of insulin, but the nurse read it as 50. It's why it's important to have leading zeros instead of trailing zeros. Lazy doctors and nurses. The Institute of Medicine, an agency of the United States government, issued a report on November 1st, 1999. That increased awareness of patient safety and, more specifically, United States medical errors.
Patient safety is a shared responsibility between the organization and the individuals working in that organization.
There are about 100,000 patients that die each year due to medical error, and many still are not reported because of fear of retaliation.
In 2004, the Joint Commission analyzed 2,455 sentinel events from hospitals across the United States and reported through root cause analysis over 75% of the events were due to communication failures, and approximately 75% of the patients involved died.
Every year, the Joint Commission puts out goals that address current healthcare needs of the population. The panel that is in charge of setting these goals are a mix of healthcare professionals. These goals are intended to improve healthcare.
The Institute of Medicine claimed that there is pre-existing knowledge of how to prevent these errors. It set a minimum goal of 50% reduction in errors over the next 5 years. The report lays out a comprehensive strategy to reduce these errors.
The ISMP receives 1,200 to 1,500 cases of serious complications arising from the use of drugs each year. Approximately 25% are related to the name confusion.
In a 2001 USP report, drug name confusion accounted for 15% of all errors reported to the USP's Medication Errors Reporting Program between 1996 and 2000.
Between 44,000 and 98,000 people die each year as a result of preventable medical errors.
As of 2007, the goal of reducing medical errors by 50% has yet to be met.
You can have brilliant ideas, but if you can't communicate them, your ideas won't get you anywhere.
Go ahead.
Wonder what this is for. Hey. It's of insulin when she was supposed to only get 5. She's about to go into an insulin coma? Wait, did I say diabetic coma?
You said insulin coma.
Don't laugh. This requires a system to have a good picture of what's going on. Only you can prevent forest fires.
And your leg hurts too. Okay.
See this girl here that looks all pale, needs a haircut, maybe a manicure? She's dying.
In 2004, the Joint Commission analyzed 2,455
Great, start again, because I think you messed up.
Analyzed
What is it?
Analyze.
Analyze.
I was like, that's not a word.
Maybe read everything fast.
You can have brilliant ideas, but if you can't communicate them, your ideas won't get you anywhere.
Personally, I don't trust nurses and doctors. They're never doing anything. No work at all. Well, besides them, they don't count.
Hospitals across the United States and reported throughout
Through root cause.
whatever. Someone else want to do this?
20% of the events were due to communication failures and
Patient safety.
Just leave it down. Leave it down so it won't fall again. Okay. So while she's talking, you can mess with the pup. Okay? Because it looks weird in your life. It just looks really fake. Right by her?
Yeah.
In 2004, the Joint Commission... That's not mine. I was like, that's
Get that out of your head.
I'm gonna pin your ankle.
What kind of nurse are you?
She's not. She's a doctor now.
You never listen to patients. Never. They lie. They're all drug addicts. Okay.